This is a contrast and CT scan of a 41 years old female patient. The patient presented with acute onset pain in suprapubic region, fever, and leukocytosis on blood examination. The patient has got multiple intramural uterine fibroids. These have resulted in marked distortion of the myometrium. Normal looking myometrium could not be visualized. There are two intrauterine contraceptal devices. Now this is the right ovary here. This is a follicular cyst, a thin walled cyst in right ovary. One IUCD is this one, while other intrauterine contraceptive device is this one here. Now there is an abscess in the space of Retzius. This one here. This is also known as retropubic space or cave of Retzius or pre-vesical space. This is a moderately thick-walled cystic lesion here. CT density varies from 14, 9, 42. Irregular inner surface at places. Density of adjacent fat is increased. There is enhancement of the surrounding wall. This lesion has indented the anterior wall of urinary bladder and extends up to this level, up to the level of pubic symphysis. Please observe the surrounding inflammation and increased density of the adjacent fat, thickened peritoneum. Now this is the median umbilical ligament which is inflamed and thickened, this one. This is the sagittal scan. Now this is the follicular cyst in right ovary. As I scroll it medially, multiple intramural fibroids causing marked distortion of the myometrium and endometrium. Now this is the abscess in space of Retzius, moderately thick, enhancing walls, irregular inner surface, fluid attenuation center. Now this is the pubic symphysis here. It extends downwards posterior to the pubic symphysis as well. It has indented anterior wall of the urinary bladder, marked surrounding inflammation. Now this is the median umbilical ligament which is also inflamed. It extends upwards. Space of Retzius is quite notorious to have hematomas, abscesses, and for accumulation of urine in extraperitoneal ruptures of the urinary bladder. This is a delayed scan. Two intrauterine contraceptive devices, multiple intramural uterine fibroids. Urinary bladder is opacified by the contrast medium, and this is the abscess in space of Retzius. Please observe surrounding moderately thick wall and the inflammatory stranding of adjacent fat, thickened parietal peritoneum here, and this is the inflamed median umbilical ligament, this one here. This is the sagittal scan, delayed one. A typical presentation of an abscess in the space of Retzius.